the other panels of commits and submits. Good afternoon to everyone. I would like to thank FIS for the invitation to take part in this conference. It's a great honor for me to share today's panel with my colleagues on the national health data work and its impact on health. So we have Gabriella Neves. She's a psychologist, and she works at Datasus. And we also have Rogerio Boros, who works in Microsoft as a director of the health industry. Good afternoon. Good afternoon, Dr. Eliezer. Yes, we are having some trouble with your audio. Well, yes, now we can hear you, but your audio is kind of choppy. I can hear you well, he says. Gabriella, can you hear us? Apparently, Gabriella is not connected. Well, I think Gabriella is not connected. So let me just communicate. So let's start today's activities. And this theme regards something very important and information that somehow helps us in our activity. In healthcare is no different. There are many challenges for us to overcome. And not just leaders in healthcare, but especially users who, at the end of the day, are the ones who have the data and have the right to share it. It's fundamental to talk about data applied to the healthcare system in a very broad way, so that those who are here watching FIS 21 are aware of the impact it has. So both in outpatient or hospital activities, it's fundamental to share data, transforming that into information and to serve our customers and patients within a good healthcare network. So we are going to start with Rogerio, who's going to share a little bit of the experience that he has been leading in the area of digital transformation and data governance in Microsoft. Thank you very much. Thank you, Dr. Eliezer. I would like to thank FIS and the whole team. And then this is very relevant in healthcare. And this is a point that we need to address. Brazil is already a leader with the approval of NDS with a national information policy that was published at the end of July. And it's important to have Gabriella here, and I hope she comes back. So to open our perspective in terms of the side of the Ministry of Health and Datasus and what they have been doing. And I will speak a little bit about Microsoft looking more from the technology standpoint and covering, if we were to analyze, which are the opportunities and challenges for healthcare to unlock the value of data systems. Maybe breaking it down, modern healthcare organizations have data from many different sources. We have patient information, care team, operational data, populational health. And if we start to break it down a little bit more from the macro standpoint, there are many opportunities, such as, for example, comparing the data of the patient to population data, medical histories to understand broader trends affecting populations. And as we have gone through the pandemic, for us to understand this type of information. And then there is one point that we may talk a little bit later on. How can we create open health standards that can be accessed by any organization, especially in research? If we go to a more specific level, not necessarily the national network of data, but the culture of use of data in health, we may use artificial intelligence to cross data and to empower doctors in making diagnosis. So now we are evolving to a time when telemedicine has a strong presence too, and research indicates that patients and doctors too want this to continue in the future. So one thing that is quite interesting is how can I provide a better experience in the contact between doctors and physicians? So I am here, I could be having a telemedicine appointment with Dr. Eliezer, and right now I'm saying we could turn on audio transcription, and without you as a doctor uh, and you as a doctor were paying direct attention to me either here or in the clinical environment, and all the information, the transcription of everything that I am saying that you are saying, you could would automatically go into the electronic medical record. So in a further step, in some cases, we are doing it in English, and I hope that very soon it will be available in Portuguese too. The possibility of your having a semantic analysis of everything that is being said and integrate that automatically to the EMR. So this is really disruptive and may facilitate the lives of doctors and empower the use of data to support diagnosis. And once I have had a semantic analysis, it's possible to identify many symptoms. For example, my temperature is 28 Celsius, and then they add the symptoms and they would indicate a probability that that might be dengue fever rather than COVID, or suggest tests that they might order if they take the history and they find that there is another symptom. So we talk about the macro level, and thinking in terms of policies for the country and specific um, use for data in the organization, and sometimes even for organizations to share data. We may also look at the operational level in the healthcare organizations. They always need to provide care to patients and provide optimal care. They may also have operational data to maintain the facilities and to reduce the cost and maybe reduce risks from thus avoiding potential errors that might happen. And so with different data, sometimes it requires an infinity of systems, many systems, which are not which don't always talk to each other, even though EMR apps or systems, they have structured data. We are evolving to a scenario where unstructured data sources are necessary. So there are sensors, devices, images from radiology. Another revolution that will take place with imaging data that will be the hologram, and then voice systems, bots, labs. So if we start to think and integrating everything which currently are not structured data and take out insights from there, this is very complex. Not to mention that most organizations end up using different tools and systems. How can we create a consolidated vision of the patient when they migrate from one provider to the other, how can I reutilize information? And then there is the issue of connectivity of legacy information systems. There is a study, and now I forgot who published it, but I can send you in the chat if you want. It's research that found out that less than 35% of healthcare providers in the same group reporting, exchanging or sharing data amongst them. For example, sister hospitals. And once it's outside the same group, that goes down to 14%. So there is a huge opportunity that is taking place now, and a major revolution is going on with fast interoperability response that is being used at a major scale for the interoperability of data. And I would like to praise Datasus in advance because they're using the system for adopting this in Brazil. And it provides many new possibilities. And this is more related to older systems. It was more complicated. And this really limited access to data in healthcare, even to artificial intelligence. So what I see as part of the initiative created by Datasus by creating a national data network, and as healthdata.gov, and other open data, because there are two aspects. One is open health data, and we'll be able to talk more about that. And the other thing is patient-specific information that they have portability as they change providers, whether they are public or private. So either tests that they have done by a public facility or in a private facility. How can I assign portability to that information, and it may get to the doctor providing care to that patient with the consent of the patient, of course. This is a major challenge, but it's very important. And for open data, which is something that we should touch on, there are many opportunities for Brazil. Today, I think an institute is really looking, and there are more than 173 health techs, and Albert Einstein is sponsoring, and there are major investors in this area. And the possibility that we have in terms of open data will allow much more innovation in this industry, and a lot more innovation. I think that I have used my 10 minutes. I'm going to stop, and I may complement afterwards. Thank you very much, Rogerio. Hello, good afternoon. Can you hear me? Yes, we can. Sorry, right at the beginning, I had a problem at the beginning of our panel. Good afternoon to everyone. I'm Gabriella Neves. I'm the coordination of digital systems of the information system of SUS at the Ministry of Health. I would like to thank on behalf of my director and my coordinator and a director for the opportunity of taking part in this conference and to talk about the National Health Data Network. And so there is so much content. It's such important people here. It's an honor for me. So the network has been built by decision of the government in May 2020. It's part of the federal program, which is the Connect SUS program. The network is a strategic component of that program, together with Informatiza BS, which is the informatization or computerization of basic healthcare system. And this is the national platform for health services, innovation, and information. It's the interoperability platform. It's national. For the first time, we were able to have a repository where we can share information and health data. And we always emphasize that it's not just another information system, but it's rather a major engine to connect any health system and also to connect different players and different types of data, of health data, all over the country. The Connect SUS program is a program by the federal government. It materializes what we have recently published, which is the Digital Health Strategy for Brazil. And as part of that document that provides an 8-year vision, it provides a strategic vision, which is to recognize and establish the National Health Data Network as a major national platform for data sharing. Augmenting information sharing in the entire network of healthcare, whether public or private, with the main objective of allowing the continuity and transition of care. For the dissemination of data, today we have what citizens use most frequently is the Connect SUS Citizen, which is available as an app on the 2 app stores and also in a web version.
It provides results of COVID test, digital immunization card, a certificate of immunization once a COVID confirmation of vaccination is delivered, also medications taken, and the past 2 years of hospital admission. We also see another interface, which is Connect SUS Professional, which is access to health data by professionals. The electronic medical record of the public healthcare system, it's called ESUS-PS at primary care. It includes an access button to Connect SUS Professional. So professionals can access the clinical history of the citizen with the data that are part of the healthcare network. And what is the main strategy of the national network? It's to strengthen the culture of data sharing in an ethic safe way, using the database of the Ministry of Health, for which we have been collecting and storing information for such a long time, so that the Brazilian population can have access to said data. We also want to create mechanisms to create standardized message. We have created the standard of interoperability that Rogerio mentioned. It's the FIRE. It is the standard that we have used to train professionals. It is a very important standard, and it's very easy to exchange clinical documents and also exchange information about health. Finally, adopt the existing taxonomy, all the methodology and terminology widely used. RNDS integrates millions of doses of vaccines given and millions of COVID-19 tests carried out by the public laboratories and also private laboratories, 280 million doses of vaccine and 140 integrated third-party systems. So it's not only the system provided by the Ministry of Health, which is widely known, it's called CPNI, National Program of Immunization, but there are also other systems that have been adopted by states and cities throughout Brazil. And 40 million test results for COVID as a result of integration with private labs. There are 390 clinical labs fully connected with RNDS, our network. Connect SUS provides a certificate of confirmed vaccination. Citizens have been using it widely. There was a boom of download of app, but we expect to have a super app with a number of features. This is going to be what we are planning to do next year, to have more data available with a number of health technical instructions to citizens as well, so that the app can be recognized as being of value to our citizens. So that was my initial remark. The network is our digital strategy to Brazil. We are still paving the journey of this perspective of digital initiatives, but it's quite promising, and I am sure we are going to be able to interact increasingly more with the citizens, considering, of course, the rules of GDPR. Thank you for the invitation. I don't know if I spoke too fast, but I would be glad to interact and also answer questions. Thank you, Gabriella. You did great and a very clear presentation, emphasizing the importance of our network today. No questions have been submitted to us yet, but I would like to hear from you. And Rogerio just addressed it when he started his talk. Users, whoever they are, and we are talking about users of the universal healthcare, citizens compare connectivity and utilization of a system, regardless of what it is. It can be retail, financial system, healthcare. What is your contribution as leaders of the project so that the experience of open health can really be empowering, so that people can understand what it means in terms of managing their own health? We do it when we have a financial transaction, when we want to buy something. Why is access different, and how can we, let's say, unlock the process? Would you like to go first, explaining the app of Connect SUS? I can give you an independent side of it, thinking about all the transformation and the expectations of patients. Would you like to go first? No, please go ahead. First of all, we have to think what we want to be in the center of our strategy that's going to be taken to patient, offered by a group of private health or by our universal healthcare system, providing, of course, interoperability, which is a very important step of the Ministry of Health. Once we define how data is going to be acquired, interoperability standards, compliance, security, Then we can go into creating other rules. Utilization by all players in healthcare, so physicians, population, allied healthcare professionals, administratives, all of those who need to have access to a medical history, for example. And also using methods such as artificial intelligence. So what are the rules and parameters to be defined for its applicability? How can we give access to patients so that they can have self-service, regardless of being public or private? So how can we think to offer that? How can we create programs to manage them and to increase productivity? Analyzing all these points, we can start designing our experience in each one of them. Always trying to provide the best experience to our patient, better perceptions, generating positive changes. I'm a user of Connect SUS. I'm very happy to have my immunization certificate there. I think it was a very interesting integration. I was amazed at the data that Gabriella shared with us with the number of connected labs. What we try to focus on is on having a connection with market standards. So lab tests, vaccination. What about radiological examination? So DICOM standard, what is going to be used? Another thing which is really relevant is the following. It will be too complex to get to a common data model. But there is an opportunity, and I've talked about open health before. I think we can bring together the public and the private sector in Brazil, which is already taking its initiative of R&DS. And let me greet Jackson Barros, who is the creator of it, a fighter and advocator of that system. If we want to create an open health model in Brazil, we start using it in within these lenses, something integrated for health facts and for existing private groups, I believe we would be able to leverage further our results. It's really difficult to explain what would have to be done, but we have to understand what these basic standards are. What are the standards of interoperability, common data model, and the experiences that we want to provide. And finally, Brazil has taken a very important step towards that, which is the use of GDPR in Brazil in a model of having consent so that data can really move from one place to the other. And there are a number of concerns we should have with data and privacy. And I think that healthcare data are more sensitive than financial data. In terms of users' experience, depending on investment capacities, different providers could provide different things. So a screening chatbot that would really authenticate data, healthcare plan, and just facilitate the check-in. Or it can be done at the level of primary care center where we schedule in advance without calling. So just scheduling an encounter or a visit in a primary care center. And this is going to be designed depending on management and also depending on investments capability. If we make a reference to FIS at the basis of the pyramid, where we have data interoperability, all these innovations are going to take place. Excellent. Good. Thank you, Gabriella. This is an era in which patients are having increasingly more autonomy, and they are part of the process of healthcare. It's a gradual process. Many citizens are still not aware of how rich and valuable their health data are, and the importance of being aware of it, knowing that they can manage their own data. And the information and data can help them in the process of care and in the process of health recovery. I think it's still a gradual process. With the experience of Connect SUS, we can see that citizens are not very familiarized to understand flow, exchange of information. The experience we have with COVID vaccine, before COVID, nobody cared about manufacture of vaccine or the name of vaccines. I think we have been through an interesting experience. What is the name we are going to use? Is it going to be the commercial name? Is it going to be the popular name? Is it the manufacturer's name? COVID has really changed the understanding of terminology and how to introduce the vaccine to users, because we were used to presenting information to healthcare professionals alone. Healthcare professionals were the players that would have access to data and take action. Now things are completely different because we have the citizens having access to information. Little by little, citizens are becoming more and more aware. We have investing in user experience, as Rogerio pointed out, in the interface experience, because we think that sometimes the journey is obvious or the flow is very simple, and it's not necessarily. Sometimes the instructions are not as clarifying as they could be. So we've been thinking about accessibility. We've been thinking about vulnerability, social and digital vulnerability to have access to information. We are constantly focusing on it so that citizens can be aware of how important health data are, and that they have to protect them and use data efficiently for their own good.
Well, when Rogerio talked about the minimal data, what we can see working with support and to users, we see that whenever they realize that there is an app that will hold their information, I want everything. I want my whole medical record in here. I want to have access to the data of my surgery that took place 5 years ago. We might never be able to give everything to fully meet the expectations, but the minimum that is relevant, you need to meet those needs. We need to offer that to citizens. And I think that this is the main exercise when we create models and when we share data. And so from that perspective, it's very good that Dr. Jackson mentioned it. He was really one of our mentors. And he drove us every day for the RNDS to work. And for seeing the Connectus app working is a big victory in his part as an idealizer of everything. Well, very nice. You have touched a few times on the issue of privacy and the pandemic, the COVID-19. Last year, we had, through testing and tracing of contacts of positive SARS-CoV data. Who does that data belong to? Who is the owner? Some have been accused, this might not have been the best word, but of invading a person's privacy uh, and in knowing about their context. Of course, this was an exceptional model. We are evolving towards that. So we are going to be monitored in our movements, both in terms of isolation to avoid the spread of diseases, but there's also the side of invasion of privacy, and health data are much more sensitive than financial data. So could you tell us a little bit about privacy, data ownership, and this, how far goes each side in terms of the health management and our own private lives? Gabriella, you go first, please. Well, whenever I think of the limits, whenever there's a question like that, between collective health and individual health and private health, going to private issues, I believe that the limit needs to be ethical. And we need to be very aware of which ethical principles we are talking about and we are favoring. Are we going to favor the principle of autonomy, social justice, collective interest? This needs to be very clear. So, COVID information during the pandemic, and it has an impact on global health and collective health too. I think that the government or any organization needs to position themselves ethically. So where the institution supports itself in order to decide which interests are going to prevail. I can give you an example of Datasus. Yes, we do have, there is a decree for data sharing to share any data between federal agencies. Of course, once you're talking about health data, health managers have autonomy to define criteria of how sharing is going to take place and also to define if the information can or cannot be shared. When it's there is a good justification for the access to the information, and the, the decree has the justifications for the sharing of data, then you wouldn't need individual consent. So is there a greater interest, which is to make going back to work safe? What is the purpose lying behind access to information? So the analysis of this access and the finality and the hypothesis of treating some data must be relevant, and we should make it very clear which are the ethical principles that are being taken into account. Well, a very interesting question. I think that healthcare is a heavily regulated industry. So there are different rules in different countries. and I'm not going to cover the regulation aspects in my answer because I don't deal with them. I'm going to approach it from a slightly different standpoint in terms of what we can do through technology. I'm going to separate two things here. One is the data that I, patient, or I, as a doctor or healthcare provider, am going to share with the consent and with the identification of the person. This is one piece of information that, according to the LGPD, the data protection law, that you need to provide consent for the sharing. The other thing is, how can we make use? And that's why I said that there are two sides, open health data and open health only. Open health is just my portability of going to other systems where there's a consent. Very similar. Someone wrote a very interesting paper on that, Guilherme Hummel, um, a major editor in this industry. Quite interesting, comparing open banking and open health. He is the scientific coordinator of Hospitalar Hub, and there is something interesting about that. On the other end, we have the following. I want to start having open data, and the data should be open like this. They should be made anonymous so that it is impossible to identify, and then we need to use solutions that will make it possible for us to read the document and it becomes anonymous, and this will be available to all major public and private groups for research, to improve diagnosis, to train models. And this is a major opportunity, and even not just for private organizations, but for the government, that they can monetize it. And they are developing, for example, molecular biology, new medications. So there was a fight for having medications, um, having information that will allow the identification of side effects. And all of this is very, very important to expedite the scientific process and in terms of bringing new things. For example, I will comment. So Tech Trials is a Microsoft partner that works with business intelligence using open data in the area of health. So taking one example, for example, rheumatoid arthritis, and the whole disclaimer, and I'm not a doctor, Dr. Eliezer might correct me if I'm wrong, but rheumatoid arthritis in autoimmune chronic disease that affects inflammatory, that affects joints, and it has more than 50,000 cases in Brazil. So they created a whole process of visualization for us to understand the distribution of those cases by age group, gender, which is the predominance, what do they show in the data, for example. There is a predominance amongst women between 56 to 60 years of age. And then as part of the data, many data that they could read, then break down the regional visualization to predict future cases. How can that help? For example, it may help a health department to have action planning, the planning of educations and medications to delay the progression of disease. So these are things, these are public, open data, but I can provide a vision so that we may take initiatives at the global level in a country. And this should be looked at with good eyes and should not be avoided. What should be avoided is any risk to access and safety. Then, with that regard, we really worry at Microsoft to have three fundamental pillars. One is the trust in utilization of data. So anyone using data, and then I'm going to say, but we as everything is going to the cloud, it's very important for us to trust that any user, whether it's private or public or government or whoever is using, they can trust that the data will not be monetized, that the data belongs to you, they are cryptographed for your own use, and that you have full control of how this is going to be used in compliance with the policy determined by the public and the country. So you need to trust who's going to use your data. The other thing that we have started doing, so health data is critical. So you need to have scalability of access and also resilience. So it can be missing. You can disappear when the patient is there at, for example, during a surgery. And so I was even saying that one thing that I always like to say, the same impact that a radiological test had in diagnosis, holography will have for surgery. Because it's really amazing. I'm not going to go in there, but the surgeon who can see a radiological test over there in the OR and see over the patient, the many different cuts. It's an amazing experience. This is reality already. It's happening. And so at a time like that, we cannot afford for the system to crash. It cannot access the images. So it needs to be resilient, reliable, and scalability too, because then we are talking about health data. And no matter that financial data is data where we have millions and millions of transactions, they are usually small. It's a small text information. And then it involves the whole history, the whole chart. So the volume, it doesn't have the same number of transactions, but the volume of transactions are significant. And lastly is the issue we have already touched on, which is regards security, the investment in cyber defense solutions. They're very significant. Microsoft invests more than $1 billion just in research of and development in the area of security. And we want to have all certificates, globally speaking, in every area, and especially in the area of health, as it is a heavily regulated area. So we have these certifications in this industry to assure the protection of data. And even a cyber attack, and then in any body or healthcare organization and financial loss. And then data access and that prospect and also cyber protection is key in any discussion that we might have with that regard. And I think that's it, and I may try to complement.
We are coming close to the end, and you've talked about monetization, for example. This is a very frequent discussion. 2 days ago, a US genetic company stated that they would use their base to leverage research and development in genetic knowledge. So their stock price increased overnight. So in the end of the day, the data they are using to increase their own value are client data, right? We cannot hear him. What we want as health leaders is to improve system efficiency, trying to reduce waste, rework. There is no connection among the different players, as you have very well pointed out. In your opinion, what is the main action we need in Brazil for interoperability and data sharing would would really take us to appropriately using data so that we wouldn't waste. Could not hear the question. I'm sorry, I could not hear what you said, but I think I understand the gist. So how can we foster data interoperability to reduce waste? It helps us in uh, billing and at the same time providing health clinical care. How do we generate value, and how do you expect a health care to happen? And information exchange can be very helpful in this new perspective of offering financial incentive, billing, return. Of course, avoiding new tests, for example. So let's say a primary care physician would have access to a medical history of someone who had been an inpatient for a while. So if the primary care professional did not have access to that before, because these are systems and different networks of care, part of different areas, so maybe the person wouldn't have access to that. Once again, using SUS services, exchanging this information among healthcare networks, and by doing that, funding of public health care can be properly made. In Alagoas, when the first physician accessed healthcare, it was a primary care physician, and he found out in that Connect SUS, in contact with Connect SUS, that it was a pregnant patient, and she had had previous admission because of a miscarriage. And he said, well, she has never mentioned that. And this is really important for prenatal care. It was great for us to see that it was the first access to Connect SUS with this patient for which the physician had access to such a relevant piece of information. So that makes us see how it can be beneficial to healthcare at large. Wonderful, wonderful story to share. If I may, I would like to share cases, but analyzing the private market, but I think that the same applies. Whatever we can do in public health, we are payers, the taxpayers. So whatever we do, over 80% of the population is exclusively covered by SUS, and we have private care of covering the other 20%, but still hybrid. There are two interesting examples of what you have asked. Fullerton Health, one of the main healthcare providers in Asia, it used clinical analysis to save to almost 10 million patients. It developed a program for chronic disease to reduce the cost to patients in 60%. And it was a specific detail for cost reduction to patients. For example, St. Luke Health Partners. It was data synthesis, real electronic data of patients, reimbursements, to develop a stratified index. So using artificial intelligence, they analyzed $400 million, and they had an economy of $20 million. It's a lot just to have a synthesis of Shanghai Children Medical Center. They created a repository of data. So generating savings for the economy. And it has reduced medical errors in 11%, reducing the average length of stay and avoiding rework in 50%. With that, they reduced in 10%. If it were a public hospital, it would be saving in a number of other things. It's a risk to a physician and to patients, right? Because who wants to undergo to have a problem of medical error? So these are a number of cases in which that would be bring a benefit. So let's think about how we can really do that. As Dr. Gabriella has said, physicians, hospital A, and the patient could see a history from another hospital. This is something that's going to reduce errors. We have to think how to do it. And that's what I would propose, which is an open health involving the government and the private entities, because Brazil can create a model that can work for Latin America and really bring us an advantage. And we have to think that example that we have seen. And I think that this is something that we also have to consider. Wonderful. Thank you very much. I've learned so much. All of those who have helped us for nearly 1 hour have learned a lot. Thank you for your generosity, for your participation. And please receive our warm welcome. Thank you very much.